Thank you for joining us here today. We're going to start our Facebook Live in 1 minute. Feel free to say hello and where you're plugging in from. Hi, everybody. Thank you for joining us here today. My name is Fabiana Bacchini. I'm the Executive Director of the Canadian Premature Babies Foundation, and we are really committed to keep you informed and updated with the latest developments of the COVID-19 and what is relevant for parents who have premature babies who are either in an ICU or at home with their baby or being recently discharged. Every Monday and Friday, 1 p.m. Eastern Time, we are bringing you experts to answer your questions and concerns. So log in, follow our social media channels to see who is our next guest for the following week. I just want to point it out that please do not share your personal health information on Facebook, as it's on a safe platform. And if you have specific concerns about your child, always consult your physician. And every Wednesday at 1 p.m., we have Kate Robson, who is a psychotherapist and a mom of 2 preemie girls, having a real-time peer group also here on Facebook. To get the link, you join our Canadian Preemie Parent Network group, which is a closed group for parents only. And obviously, our group is available to you 24/7. We have over 2,400 Canadian families sharing information, resources, but also celebrating the achievements of our little babies. And we are very happy to be able to provide the support for families who have been into the ICU. So you can also check our website, canadianpreemies.org, where we have a lot of information and podcasts that we can access anytime. And today, I'm very happy to introduce you to Dr. Hoban, who is a neonatologist and Director of Breastfeeding Medicine at SickKids and Assistant Professor at the University of Toronto. Her current projects include improving human milk provision in high-risk neonatal populations, milk biomarkers to predict lactation success, inflammatory markers in human milk, and human milk as a potential stem cell therapy for IVH. This is something that we can talk about, and we are very excited about it. So Dr. Hoban, thank you so much for joining us today. Thank you for taking your time away from your children, away from the hospital, to be here with us, really educating the families who are either in the ICU or out in the community.
Yeah, thanks for having me.
My first question certainly is about breastfeeding during this pandemic. Is it safe to continue breastfeeding if you already started, or if you are still pregnant, if a mom is still pregnant, is it okay to breastfeed because you don't know if you're positive or symptomatic? So how can we make sure moms and babies are safe?
Right. No, it's a great question, and it's one that we've gotten a lot at the hospital. And obviously data is changing all the time, but really especially in pandemics, but in any time, breast milk is by far the best thing that we can give to babies, particularly premature babies. We know that breast milk has great benefits in the short term. It reduces necrotizing enterocolitis, bronchopulmonary dysplasia, or chronic lung disease in prems, as well as things like retinopathy of prematurity or the eye problems that go along with being a prem. Along with all the other great benefits like reduced infection rates in general as they get older. And with COVID, those recommendations haven't changed at all. There's been quite a few small studies looking at if there's any transmission of COVID-19 through breast milk in moms who are positive, and none of the studies have shown any active virus in the breast milk. If we look at old studies of SARS, which was also a coronavirus in which we have a little more data about, they did find with SARS that there were antibodies in breast milk. So not the virus itself, but the protection against the virus. And so we think that breast milk, if anything, is protective and definitely not harmful during the pandemic. So we would really encourage all moms, just as we did before, to continue to provide breast milk or plan on providing breast milk if they're pregnant to the best of their ability, whether they have COVID, they've been exposed to COVID, or they're lucky enough to have had neither.
That's great to know. But if mom has the baby in the ICU, or if the baby's home and somebody in the house is positive,
Right.
so what are the recommendations in that case?
So anytime there is a sick family member, whether you have a healthy term infant or if you have a prem who's just gone home, obviously using as much precaution as you can. That person shouldn't be caring for the baby if that's possible. If it's the breastfeeding mom or the parent that's positive, the public health agencies are recommending that moms use a mask when breastfeeding to avoid the droplet or the respiratory contact with the baby, or to pump and have someone else feed the baby if possible who is not sick. But COVID really isn't any different than other typical illnesses, in that if you're sick, you should try to avoid contact with the baby. As far as actual COVID in infants, there have worldwide been a vanishingly small number of reports of babies actually getting sick with COVID-19, even when they've been born to positive moms or moms that have developed COVID in the first few weeks after delivery. And so we think that even when babies are exposed, it's unlikely that they would get sick from it or very sick from it. That being said, obviously we would still like to prevent that if we can. And so just using your usual precautions, hand washing, and trying to keep them away from people that are sick.
Absolutely. I think that's a reassuring for us parents, or I have my son who is 7 years old now, but my first question was, because he was he at a high risk of getting sick? But often that's the first question parents ask, are my babies at higher risk because they are premature, or they are in the ICU, or just recently discharged?
We don't have any evidence that premature babies in general are more at risk of COVID. If we extrapolate from other illnesses, their immune systems, especially when they're first discharged, aren't as robust as that of a term baby. So we presume they are potentially at a bit higher risk than your average baby. But again, there are, even from Europe, from China, places that have had more experience in the past few months than us with COVID. There are, literally a handful of cases worldwide in babies. So although all of us are very worried and nervous as parents, whether we have small babies or school-age kids, the chances are that our kids are going to be just fine.
Okay, that's good to know, and that kind of reassurance for us, and breathe a little better.
But still wash your hands.
Absolutely. I think this is something that NICU parents have ingrained.
Yes, it's instilled into them. Right?
Yes, we come home with all the hand sanitizers. I think this is something that hospitals teach us really well how to do, and transitioning home.
But my kids greet me at the door when I come home from the hospital. They literally come with a bottle of sanitizer. Don't let me in the house.
That is very cute. So you're talking about moms who are pumping at home. Is there a specific recommendation now how to wash the pump kits? Has that changed because the virus might be present in the home?
So the recommendations haven't changed for pumping at home. Just like, again, any other virus or any other illness, we would just want kind of standard cleaning of your pump kit and sterilization as recommended by your NICU. The only recommendations that are changing a bit are more on the hospital side. So because we know that there's evidence that COVID can stay on plastic for an extended period of time, for example, if we have moms that are known to be positive or suspected to be positive with COVID, we're cleaning the milk bottles that they drop off in a different way prior to storage. But that's really on our end, from a mom or a family end or at home. Really just your standard kind of kit cleaning and sterilization should kill any bugs, including COVID.
And that's wonderful. And we also have some resource on our website that families can go and check the resources on how to properly wash the kit at home and what they can do at home. But I want to talk to you about pumping, because this is such a pressure for NICU parents, right, to pump. And we always discuss when to start pumping and how can we keep moms motivated to pump. So can we talk a little bit about that?
Yeah, definitely. And that's something I'm really passionate about, and something that we've really worked hard on. Kind of changing at SickKids is really trying to help our moms pump as early as possible. I definitely want to recognize the fact that pumping is incredibly challenging. We know that even though breast milk is natural, breastfeeding, even at the breast, can be tough. Pumping is a whole higher level of challenge. And I really give such kudos to our families who are pump dependent for both initiation or the beginning of lactation, as well as maintenance of lactation, where they're looking at weeks to months potentially, or even longer, of babies who are not going to be able to feed at breast, either exclusively or at all. So it's definitely tough. That being said, breast milk is a medicine for babies, especially for prems. And donor milk, although it's a better substitute than formula, doesn't really have the beneficial properties that mom's own milk does, which is made just for her baby, that no one else can do. With pumping though, because you're initiating or starting lactation with a pump, even the best of pumps aren't as good as a baby, because they rely on humans to make them, and humans to use them. So instead of having a baby that's crying at us to put them to breast, we have to rely on ourselves to put the pump on our breast, which is again a little tougher to do. What we really recommend as soon as possible, even when moms are tired and it's right after delivery, and they've often had a tough or a challenging delivery at a gestational age that they didn't probably expect to deliver at, and they're processing that they have a sick baby. Even in those circumstances, if you can pump within the first hours of life, we know that alone, pumping in the first 6 hours, can actually change your long-term lactation potential. So moms that are able to pump in those first few hours are much more likely weeks and months down the road to still be breastfeeding. And we think that early pumping, both pumping early, pumping frequently, so at least 5 times a day, and not going longer than 5 hours at night, even when you're exhausted. So early, frequently, and then pumping with a high quality pump, so a double electric pump. Those 3 things can really program the breast to make milk. You're really telling the breast that this is something I want you to do. You need to start doing your job, even though I don't have a baby that I can put to the breast right now. I need to make milk for that baby. And you need to tell the breast that that's what they need to do. And the only way they know to do that is to pump early, frequently, and with a high quality pump.
Absolutely. And I can totally testify to that, because I was right after my C-section, the nurse came to my room and brought this hospital grade pump, and I started crying. She said, you gotta start pumping. I said, no, I want to breastfeed. I didn't know that I could not breastfeed a 26-week baby.
Right.
And that really, my volumes were great, because I think I did start on that right away and off. So I was able to,
right.
I kept pumping for a year, but I breastfeed my son for almost 2 years after that.
That's amazing.
And I think that was a success story. Is that obviously not everybody has that success stories,
right.
But for moms who don't have that volume, is there any practical tricks that you can give to those moms to reach a little bit of a smaller goal, maybe a
right.
bigger goal, or at least get the colostrum out in the first few hours?
Exactly. And again, we know every mom is different. Every mom comes to a delivery with potential different set of challenges or different expectations, or even different goals for what they want for their baby as far as feeding. For some moms, exclusive breast milk is kind of their only potential good outcome, which puts a lot of pressure on a mom. Mm-hmm. I think any amount of mother's milk is, if that's the best you can do. We know that it's very, very challenging, especially when moms are sick, often have preeclampsia or other challenges with delivery. It can be a big challenge. So we'll take anything that we can get. Exclusive is great, but any mother's milk is good. So especially in those first couple hours, colostrum can sometimes be quite thick. So sometimes hand expression is the best way to get the colostrum out. And lactation consultants or nurses can help show moms how to properly do that. And then that is like liquid gold. We can give that to the baby right away, even when they're sick or intubated. We can paint it as oral immune therapy into their mouths. And then even if they do hand express, we still encourage moms, though, to use that double electric pump afterwards to program the breast, because hand expression doesn't really, since it doesn't have suction, it doesn't program the breast in the same way. So as far as improving moms' volumes to help them meet whatever goal they have, the biggest thing is more pumping, more pumping, more pumping. I think moms often hope that there's some kind of magic bullet or an herbal tea or something that they can do. Usually the answer is pump more. And again, that can be challenging, especially if you have other kids at home. But trying to do power pumping, where even every 2 hours you're trying to pump during the day, give the pump parts to dad or to someone else, have it be someone else's job to do all the cleaning. So you're just focused on resting and pumping, to be honest. So pumping frequently with a good pump, making sure you're staying hydrated. There aren't any specific foods or other things like that that would necessarily help your milk supply, but staying hydrated and trying to stay rested, which again is tough when you have a tiny baby in the NICU, but trying to do the best you can. There are medications, prescriptions like domperidone that some moms try, but that really should only be kind of a last resort. It's really, really working on frequent and early pumping. That's really the key.
Okay, so when is that absolutely not possible? Now, in Canada, we have the milk bank.
Right.
Can we talk a little bit about the milk bank? Because I know it's something that people are going to it for the milk. And now in terms of this pandemic, we are predicting to have some like a lower volumes, or information that I had for a couple of weeks ago is that Quebec will not accept new donors, but just the regular donors. So what is the situation? And can the moms, if they can absolutely not pump or breastfeed, can they go to those banks as a resource?
Right. So we definitely use donor milk quite a bit in the NICU. We know that all moms aren't able to have a full milk supply. So donor milk, it's when it comes from a milk bank, it is pasteurized. And so although studies are ongoing looking specifically at COVID with pasteurization, it's like any other virus in that it would be eradicated or destroyed with pasteurization. So donor milk is safe from that standpoint in a pandemic. There were concerns, or have been concerns, that our donor milk supply might go down with moms who are donating, finding it more difficult to get out of the house or more difficult to actually donate. So far, our reserves are pretty robust, so we haven't seen we haven't had to change our guidelines for who gets donor milk or anything like that yet, at least in Ontario. But donor milk is definitely a great option for our most vulnerable babies when we don't have that supply of mother's milk. And we do know it definitely decreases the risk of NEC, or necrotizing enterocolitis, a really serious gut or tummy problem that we see in our prems.
Absolutely. And we already talked about some of the benefits for the baby, but there is also benefits for the moms. Mm-hmm. So can you talk about the benefits for moms? What does it give to her besides obviously the satisfaction of breastfeed your baby and you're providing the best to your baby?
Well, I think what you brought up, the satisfaction, is I think a lot of moms do who do provide milk. I think that is a big part of it. When you deliver a baby who's sick or who's born prematurely, that kind of initial experience of motherhood that you anticipated is vastly different than what you expected. You're not able to do the same things, to be able to hold your baby as easily, to do the little things like changing their diaper or feeding them, using their mouth. And so giving them breast milk, some moms feel like this is what I can do right now to parent or to mother my baby. So I think it is a big deal from an emotional standpoint for a lot of moms, that this is the one thing right now that I can really focus on, that I can do to help heal my baby, and to give my baby medicine that I made, that only I can do, which is a pretty cool superpower.
Absolutely.
Oh, sorry, go ahead.
No, I was going to ask you, because we always talk about the moms who is providing that, right? And something the mom can do. But how about the partner, the dad,
Right.
or the partner? Because sometimes, now, especially now, in a lot of units, the other partners are not even coming as often, because the mom who is breastfeeding is there. So
Right.
is there anything they can do to support and help?
I think, as we talked about, pumping is so challenging. So anything that the partner can do to help support that, whether it's doing basically everything else, so the mom can focus on pumping, cleaning the pump parts, getting mom snacks and water, helping her stay rested as much as possible, and really just supporting her in any way they can emotionally. It is a really challenging time right now with visitation, and a lot of families are having a lot of difficulty with that. And as healthcare workers, it's really tough for us as well, because we're trying to balance keeping our babies safe, our families safe, and our staff safe, but also realizing that this is traumatic for families to not be able to visit in the way that they would like. And we're doing our best to try to stream rounds, or to offer FaceTime or Zoom meeting and family meetings, but it's obviously not the same as being able to be there and putting your baby skin to skin. And we recognize that, and obviously it's out of our control, but we know that it's a big stressor for families right now.
Absolutely. And we're just hoping that it's not going to last too long.
Yes, definitely.
Because we don't really
know
the impact.
many reasons, but definitely
Absolutely.
That one. Yeah.
So now I want to talk a little bit about the moms who are at home with their babies, because with no doctor's appointments and no follow-up clinics, a lot of parents are worried about the baby gaining weight, if the baby is drinking enough milk. What can they do?
Right. And so a lot of doctors' offices are closed. That being said, there are still quite a few pediatricians who, at least for newborns, are making exceptions and are still having office visits, and are definitely doing virtual visits, which you really can't weigh a baby in a virtual visit, but at least to check in. I think some of the challenges that babies often are discharged relatively quickly once they get to full oral feeds, and so a lot of moms or families are worried that they're not getting enough. I think that's a universal worry for every mother in the world, whether they have a tiny pram or they have a huge 5-pound 7-pound term baby. Every mom always thinks their baby might need more. But babies are pretty smart. They usually will tell you if they need more. If you're putting the baby to the breast, in the first couple of days or weeks that you're home, especially if breastfeeding is new to you and the baby, we would often recommend trying to pump afterwards, see if the baby's actually draining the breast. And if you have some pumped milk still left in the breast, you can feed that via bottle or however you choose to feed. But if they're not draining your breast, then that way you can make sure you're keeping up your supply. And see if your baby seems satisfied afterwards. And if they're not, talking to your doctor about other supplementation. As far as looking at actual waking and fortification, some families do go home with mixing their breast milk with powdered formula, for example, to give it higher calories. Although in the NICU we weigh babies every day, babies for the most part don't need that close of weight management, even once they go home. So even though I think we make NICU parents a little obsessed with numbers, and they want to know, every single day, how many grams did my baby gain? We make parents crazy. It's our fault. And then once they go home, they want this data. But except for very unusual circumstances, babies should grow pretty well on what they were sent home on. And a checkup every couple of weeks for a weight should be more than enough as far as adjusting fortification or adjusting nutrition.
Thank you. And another question that parents always ask us: when is a good time to start solids, even if the baby is breastfeeding? The recommendation is still the corrected age?
That's right. So, the World Health Organization and other organizations like the Canadian Pediatric Society and the AAP do recommend 6 months of exclusive breast milk for all babies. For prems, we'd usually extrapolate that to be a corrected age, so 4 to 6 months corrected age of exclusive breast milk. As far as starting solids, most babies are already between 4 and 6 months corrected age. We would try to, move it a little bit towards the 6 months. But babies also show other signs of readiness. So are they able to sit up pretty well on their own? Are they interested at mealtime and kind of looking around at what you're feeding? So other signs other than just, can I actually put the solid in their mouth and they'll swallow it? Babies will swallow solids pretty early on, but if they're able to support themselves sitting up, that can tell you that they have a little more muscle control, both of their body, but also of their swallowing muscles to reduce risk of things like aspiration or putting food down their own tube. But breast milk for 6 months it's really all they need. Solids before that are really more for fun, but they don't need them for nutrition. Breast milk's the best thing.
Okay, so before we end, I would like you to talk a little bit more about your study on human milk as a potential stem cell therapy for IVH. I think this is something very upcoming, and we're going to be talking about it. What can you tell us so far? Where you're at with that?
Sure. So ironically, we were about to launch recruitment literally the week that clinical research shut down in Ontario due to COVID. So for many reasons, we really want this crisis to be done, but we would love to relaunch this, what I think is a really exciting study. So breast milk, we have, in the past couple of years, we found out, in addition to all the other cool things it actually has maternal stem cells in the milk. So when you feed your baby at breast or you pump and you give them fresh milk, you're giving them stem cells all the time, which I think is so cool. And in animal models, they have shown that the mother's stem cells from the breast milk go into the baby and travel throughout the baby's body and can set up shop, basically. And it's been shown, again, in animal studies that when you can give stem cells, they kind of hone to areas of injury. And so our goal with this study is to look at how we can give fresh milk to help babies who have IVH. And because IVH, so intraventricular hemorrhage, is bleeding in the brain that we can see in premature babies, we're actually going to be putting small drops of fresh breast milk into the baby's noses, because your nose, the olfactory bulb, is a direct connection to the brain. And in animal studies, putting stem cells into the nose, they migrate directly into the brain and can hone to the site of injury. So it'll be a small study, just more of feasibility, like do babies tolerate a few drops of milk in their nose? And then we'd eventually be trying to do bigger studies to actually look at outcomes, like does this help babies not have hydrocephalus or fluid on the brain after brain bleeds, and does it improve their outcomes?
Wow, that's incredible.
So I think it's exciting. Breast milk is amazing, but it has definite healing properties, and we think stem cells are part of that.
It truly is a medicine for our babies.
Yeah.
So Dr. Hoban, thank you so much for joining us here today. It was a pleasure talking to you, and I wish you all the best with your studies at SickKids, because we all benefit from those studies. So thank you so much.
Thanks so much for having me, and best of luck to everyone right now. I know these are crazy times, and it makes it's challenging trying to visit our babies in the NICU, and for everyone who has kids at home. But hang in there, and I think we'll all get through this together.
Thank you. And if you're at home, please join us on Monday at 1 p.m. Eastern Time. I'll be chatting with Maureen Luther. She's a physiotherapist at the neonatal follow-up clinic at Sunnybrook Hospital. Thank you. You have all a great weekend. Stay safe, be well, and follow us on our social media channels for the latest news on COVID and what our families doing across Canada. Thank you so much.
All right. Thanks. Bye, everyone.